Hello everyone, my name is Dr. Nita and I'm here to talk to you about my show, Time with Dr. Nita. This show basically consists of issues that women we face generally in our day-to-day activities, and then I would like us to talk about them. I would also enlighten us on some of these issues and then ways of how to solve them as well. I'm an obstetrician gynecologist and you're welcome to my show. The next point I would like to talk about is the menstrual cycle. As for the men, every day of their lives they can get you pregnant. 365 days in a year. They are always fertile. But it is you, the woman, that you need to know your menstrual cycle so that you increase your chances of getting pregnant around that time. Generally, most women have a 28 or 29 day cycle. And before you get your menses, you ovulate about 14 days before you get your menses. We cannot tell with exact accuracy when you will ovulate. We just know that around this time, your chances of ovulation are increased. Usually between day 12 and day 16 of your cycle, then you ovulate around that time. If you have an irregular cycle, that is when the problem comes. So you may need to record your menses for about 4 to 6 months so that you're able to tell exactly when the period within which you will ovulate. So usually what you do is that after you recorded your cycle for about 4 to 6 months, then you count 14 days backwards. That will give you the period around which you ovulate, and your fertile period is around this time. So it's advisable that when you've done the calculation and you've realized which time you are most likely to ovulate, then you have sex about every other day around that time. If you can have the sex every day, I mean, hey, nobody stops you. That's on to you, but every other day makes it easier for the couple to be able to conceive. For instance, let's try and calculate how you would be able to get your ovulation time from a cycle. Let's say you have a 28-day cycle. Your menses begins on 1st of January. You know that from 1st to about 28 days, that's around 28th of January, your next menses will come. So around 14th, you know that is when you're likely to ovulate. This means that from day 12, that's from 12th of January up to about 16th of January, you are most likely to ovulate around that time. So even though you may have sex on other days in January as well, between the 12th and the 16th of January, you may have to increase your number of times of having sex. It may be every day if you want, it may be every other day, but you have to increase your number of times of having sex around that time to increase the chances of getting pregnant. And then there are a few other things you may also need to look out for. Generally, women don't have a discharge. Some have pathological discharges, but physiologically we have some slight discharge. At the beginning of your cycle, there may be no discharge at all, but you realize that getting close to your ovulation period, there's something we call cervical mucus. It becomes a little bit thinner, it becomes stretchier, and then becomes a little bit slimy. And then getting very close to the ovulation period, this discharge looks a little bit clearer. It's all in order to help the sperm swim up to meet your eggs. And then there's also what we call middle smears or middle pain. Some women are able to feel when they get their ovulation. It may be on the right, it may be on the left, depending on which of the ovaries is releasing the egg. It doesn't have a sequence, like this month the right will release, next month the left will release. So long as an egg is ready in any of the ovaries, it may release it at the end of the ovulation period, and then you will feel it. It's usually this dull pain. You can go about your activities, just that it's a little uncomfortable, and then it may last for a few hours in the day. So when this happens, then you know that you are ovulating. So these are the main two things that you may need to look out for. And then there's also the applications online. There are a lot of applications which help you to calculate your menses, and they're able to predict the period around which you'll be able to ovulate. So when you use these ones as well, they guide you. But be aware that these ovulation apps, they are not 100%. So in as much as you're going to use them, you shouldn't rely on them totally. You may have to rely on the physical things or physical changes that will occur in your body as well.